81. A positive sputum culture is required for TB treatment initiation. True or false? Answer: false rationale. TB treatment can be initiated based on clinical and radiologic suspicion, pending culture results, to prevent delays, per CDC treatment protocols. 82. The BCG vaccine is effective against multi-drug-resistant TB. True or false? Answer: false rationale. The BCG vaccine has limited efficacy against pulmonary TB and no specific protection against MDR-TB, per WHO vaccination data. 83. TB can cause fatigue as a systemic symptom. True or false? Answer: true rationale. Fatigue is a common systemic symptom of active TB due to chronic inflammation and metabolic demands, per clinical manifestations. 84. Patients with active TB can safely breastfeed without precautions. True or false? Answer: false rationale. Active TB patients can breastfeed if on treatment and non-infectious, but precautions, e.g., masks, are needed initially, per CDC guidelines. 85. The nurse should assess for chest pain in TB patients. True or false? Answer: true rationale. Chest pain may occur in pulmonary TB due to pleural involvement or lung inflammation, requiring assessment, per clinical evaluation guidelines. 86. TB treatment is ineffective in HIV-positive patients. True or false? Answer: false rationale. TB treatment is effective in HIV-positive patients, though it may require adjusted regimens and concurrent antiretroviral therapy, per WHO co-infection guidelines. 87. A negative IgRA test rules out TB infection in all patients. True or false? Answer: false rationale. A negative IgRA may be false in immunocompromised or early infection patients, requiring clinical correlation, per CDC Diagnostics. 88. TB can cause renal involvement in extrapulmonary disease. True or false? Answer: true rationale. Renal TB is a form of extrapulmonary disease, causing symptoms like hematuria or sterile pyuria, per clinical manifestations. 89. Patients with latent TB require airborne precautions. True or false? Answer: false rationale. Latent TB is not contagious, so airborne precautions are not needed, unlike active pulmonary TB, per CDC infection control. 90. Ethambutol is safe for use in patients with pre-existing vision problems. True or false? Answer: false rationale. Ethambutol can cause optic neuritis, worsening vision problems, and is used cautiously with baseline vision testing, per pharmacological precautions. 91. TB can be transmitted during brief, casual contact. True or false? Answer: false rationale. TB transmission typically requires prolonged, close contact in enclosed spaces, not brief or casual contact, per CDC transmission risk. 92. The nurse should teach TB patients to complete the full course of treatment. True or false? Answer: true rationale. Completing the full treatment course prevents relapse and drug resistance, a critical patient education point, per WHO adherence guidelines. 93. TB can cause a gone focus on chest X-ray in primary infection. True or false? Answer: true rationale. A gone focus, a calcified lung lesion, is a radiologic sign of primary TB infection, often seen in children, per radiologic findings. 94. All TB patients experience fever as a symptom. True or false? Answer: false rationale. Fever is common in active TB but not universal, especially in early or extrapulmonary cases, per clinical variability. 95. The nurse should monitor for renal toxicity in patients taking rifampin. True or false? Answer: false rationale. Rifampin primarily causes hepatotoxicity, not renal toxicity. Renal function is monitored with drugs like streptomycin, per pharmacological monitoring. 96. TB is a leading cause of death in HIV-positive individuals. True or false? Answer: true rationale. TB is a major cause of mortality in HIV-positive individuals due to their increased susceptibility to active disease, per WHO epidemiology. 97. A positive TST in a BCG-vaccinated individual always indicates TB infection. True or false? Answer: false rationale. A positive TST in BCG-vaccinated individuals may be a false positive. IgRA tests are preferred for accuracy, per CDC Diagnostics. 98. TB treatment includes a combination of at least 4 drugs in the intensive phase. True or false? Answer: true. Rationale: the intensive phase of active TB treatment typically includes 4 drugs, isoniazid, rifampin, pyrazinamide, ethambutol, to ensure efficacy, per WHO regimens. 99. The nurse should assess for dyspnea in patients with pulmonary TB. True or false? Answer: true. Rationale: dyspnea may occur in pulmonary TB due to lung tissue damage or pleural effusion, requiring assessment, per clinical evaluation guidelines. 100. TB can be cured with a single antibiotic. True or false? Answer: false. Rationale: TB requires a multi-drug regimen to prevent resistance and ensure cure. Single drug therapy is ineffective, per WHO treatment principles. 101. Mycobacterium tuberculosis can survive in the environment for weeks. True or false? Answer: true. Rationale: Mycobacterium tuberculosis can survive in dry droplet nuclei for weeks, especially in dark, poorly ventilated areas, increasing transmission risk, per CDC environmental persistence data. 102. A positive chest X-ray always confirms active TB disease. True or false? Answer: false. Rationale: a positive chest X-ray, e.g., infiltrates cavitation, suggests TB but requires microbiologic confirmation, e.g., sputum culture, to diagnose active disease, per CDC Diagnostic standards. 103. Patients with active TB should be educated to avoid crowded places. True or false? Answer: true. Rationale: avoiding crowded places reduces the risk of TB transmission through airborne droplets, a key patient education point, per WHO infection control guidelines. 104. The BCG vaccine is recommended for adults in high TB burden countries. True or false? Answer: false. Rationale: the BCG vaccine is primarily used in children in high-burden countries, not adults, due to limited efficacy against pulmonary TB, per WHO vaccination policy. 105. Fatigue is a common symptom of latent TB infection. True or false? Answer: false. Rationale: latent TB infection is asymptomatic. Fatigue is a symptom of active TB due to systemic inflammation, per CDC clinical manifestations. 106. Isoniazid and rifampin are used together in the continuation phase of TB treatment. True or false? Answer: true. Rationale: the continuation phase of TB treatment, 4 to 7 months, typically includes isoniazid and rifampin to eradicate remaining bacteria, per WHO treatment regimens. 107. Multi-drug-resistant TB can be treated with first-line drugs. True or false? Answer: false. Rationale: NDR-TB is resistant to first-line drugs, isoniazid, rifampin, requiring second-line drugs like fluoroquinolones or injectable agents, per WHO NDR-TB guidelines. 108. The nurse should use standard precautions for patients with latent TB. True or false? Answer: true. Rationale: latent TB is not contagious, requiring only standard precautions, unlike active pulmonary TB, which needs airborne precautions, per CDC infection control. 109. A sputum culture is the gold standard for confirming active TB. True or false? Answer: true. Rationale: sputum culture is the gold standard for confirming active TB, identifying Mycobacterium tuberculosis with high specificity, per CDC Diagnostic protocols. 110. TB can be transmitted through blood transfusion. True or false? Answer: false. Rationale: TB is primarily transmitted through airborne droplets, not blood transfusion, as Mycobacterium tuberculosis does not typically circulate in blood, per CDC transmission routes. 111. Patients with active TB should have regular follow-up sputum tests. True or false? Answer: true. Rationale: regular sputum tests monitor treatment response and infectiousness in active TB patients, typically monthly until negative, per WHO monitoring guidelines. 112. The tuberculin skin test is reliable in infants under 6 months. True or false? Answer: false. Rationale: The TST is less reliable in infants under 6 months due to immature immune responses, often yielding false negatives per CDC diagnostic limitations. 113. Rifampin can interact with oral contraceptives, reducing their effectiveness. True or false? Answer: true. Rationale: rifampin induces liver enzymes, accelerating metabolism of oral contraceptives, requiring alternative contraception per pharmacological interactions. 114. All patients with TB require lifelong treatment. True or false? Answer: false. Rationale: most TB cases are cured with 6 to 9 months of treatment. Only complex cases, e.g. MDR-TB, may require longer durations per WHO treatment protocols. 115. TB can cause pericarditis in extrapulmonary disease. True or false? Answer: true. Rationale: TB pericarditis is a form of extrapulmonary TB, causing pericardial inflammation and potential effusion per clinical manifestations. 116. The nurse should wear a surgical mask when caring for a TB patient. True or false? Answer: false. Rationale: an N95 respirator, not a surgical mask, is required for airborne precautions to protect against Mycobacterium tuberculosis per CDC infection control standards. 117. The quantiferin TB Gold test is less affected by BCG vaccination than the TST. True or false? Answer: true. Rationale: the quantiferin TB Gold test, an IGRA, is more specific and less likely to yield false positives in BCG-vaccinated individuals per CDC diagnostic advantages. 118. Active TB can be asymptomatic in early stages. True or false? Answer: true. Rationale: early active TB may be asymptomatic or present with nonspecific symptoms, especially in immunocompromised patients, per clinical variability. 119. Pyrazinamide is contraindicated in patients with gout. True or false? Answer: true. Rationale: pyrazinamide increases uric acid levels, exacerbating gout, and is used cautiously or avoided in these patients per pharmacological precautions. 120. TB screening is unnecessary for low-risk populations. True or false? Answer: true. Rationale: low-risk populations, e.g., no exposure or comorbidities, do not require routine TB screening per CDC risk-based screening guidelines.